I'm Dr. Arvind Sukumaran. I'm a Paediatric Neurosurgeon in Apollo, Chennai. And that is about pediatric concussive head injury, that is very mild head injuries. Most of the kids have head injuries by way of trivial falls from the cot, like while riding a bicycle or while playing, they will have a fall or get hit by a bat, or the brothers or sisters might push them, so on and so forth. Only about 7 in 100 patients who come to the head injury department, that is in children with a head injury, have true intracranial injuries. The rest of them have just concussion or not even that. And as far as the concussion is concerned, at least 1 in 100 children always have a concussive head injury during their lifetime. So the question here is, so it's not that every single head injury patient needs to be seen by a neurosurgeon, but some of them need to be. There are certain conditions in which you have to take them 100%, like if the child is unconscious even for a transient time, if there is significant amnesia, if there is any weakness in the limbs, or if there is any numbness she reports, or if there is any bleeding from the ear or nose. All these are 100% you have to take to the doctor. Symptoms in toddlers and infants who cannot talk, in them it's like sometimes you just cannot console them. They just keep crying for more than 15 to 20 minutes. And even if you try to feed them, you cannot make them drink anything, even you cannot nurse them. So in all these cases, there are no questions. Take them to a nearby pediatrician or an emergency department. There will also be questions regarding the progression of symptoms from the time of injury to this current time. Once you have taken the child to the ER, the doctor there will decide whether to get an imaging, whether it's a CT scan or an MRI or not. The doctor there will decide whether to admit the child or just observe for 6 hours or even not at all. So even after all this evaluation, the doctor might decide that the child is okay and might discharge home. Subtle symptoms, which can be either in the form of mood disorders like irritability or depression, or they can have intellectual impairment by way of loss of memory and some kind of a confusion, or it can be bodily symptoms like nausea, vomiting, or not vomiting, nausea or headache, or sometimes dizziness. All these are very subtle signs of concussion. Even more milder than this, even if none of these are manifest, some of the children might have very subtle signs which can be picked up only by neuropsychological testing. So why are we giving so much importance to all these very, very subtle signs? The reason is there is something called a second hit syndrome. That is, even if there is a very mild injury to the head, that hit can affect the brain's capacity to adjust itself. And during this phase, when the brain is still healing from the first hit, if there is one more injury to the head, there is about 70 to 80% of these kids become completely normal in about 1 to 3 months. If there are prolonged and intense symptoms like headache, there are medicines can be given like a simple paracetamol. And if the child has giddiness, a lot of giddiness and dizziness and not able to balance, there are specific physiotherapies intended for these, for your gait, for your balance, and even for your there is your eye movements. And if there are any memory issues or intellectual disability, as a rule, they always resolve by about 6 months. So now your child has been discharged home. So as a parent, what are you supposed to do? The first thing is be aware of the second hit syndrome, which means you should take a proactive care in preventing a second injury during this healing phase. Give the child absolute rest for the next 2 days or not more than 2 or 3 days. And after this, for the next 2 to 3 weeks, have the child with intellectual as well as physical restricted activity, which means don't send the child to school for at least for the next 2 weeks. And once the child is okay with all these things, gradually increase the child's activity to normalcy. But whenever there is recurrence of any of the symptoms, stop right there and let the child rest for 1 more week and again start from where you left. And once the child has resumed all the normal activities, then start with aerobic, non-contact physical exercises. If the child is able to tolerate this for about a week, then resume all the normal activities. So as a message, I would like to reiterate the point that there is something called a second hit syndrome, which can be quite serious if not taken care of, or not if you are not aware of it. But reassure, like more than 80% of these children become totally normal within 1 to 3 months after this any kind of concussion injury. So it is in our interest to be aware of these things so that we take better care of our children. Thank you.